The background for my research is that in the treatment of glaucoma, we mainly rely upon eye drops to get the pressure down. But we're using these eye drops, multiple bottles in some patients. About 40% of patients need more than one eye drop to control their disease. And it gets complicated. You know, they're taking one drop at night, another one 3 times a day, and then another one twice a day, and they need a schedule. It's impossible for them to keep it straight. Most patients can't even say some of the words on their eye drops, and so that's been some confusion there. But it's also expensive because even generic medicines in 2018 can be really expensive. There's a lot of fluctuation in price from month to month. So one potential solution to this is to make your own eye drops. And the way you would do that is through a compounding pharmacy. And a compounding pharmacy can get the individual powder for 4 common glaucoma medications and compound them into one bottle that's then taken twice a day, or something like that. The way we decided on the combination to use, there are now 5 or 6 classes of pressure lowering therapy, and we picked the most commonly used molecule in its generic form from the 4 most commonly used medicines. And so, yeah, so most of the patients who were on their own therapy really stayed on the same molecules and just got switched to having them in a different way. One of the implications of this is actually that it may be a way to get patients on less expensive therapy. A compounding pharmacy will typically charge something like $50 for a month's supply of these drops. And you know, I ask most of my patients how much they're paying for their eye drops, and you'll get no shortage of surprises there. Some people have very good copays, but some people will tell me they're paying $300 or $400 a month for their eye drops. And of course, I'm always saying, you know, why didn't you tell me? This is horrible, that's too much money, but they don't know, you know, so for a patient who's in that situation, they can save a lot of money, get on something that's easier to use and easier to remember. It's sad, but you know, a lot of people just have trouble remembering the names of all their drops, and if you don't know the name of your drop, it's hard to take it appropriately. What's different for doctors if they choose to use a compounded therapy is their patient will probably be a little bit more clear in terms of what medicine they're on and how they're supposed to be using it, because it's, in some cases, it's just one bottle twice a day. And there's actually a lot of time that we spend kind of reviewing these medications. And to be honest, I'll spend a lot of time, I'll take time to write it out, and then the next visit, it's like we're back to square one in many cases. I have had patients who have put on this therapy, and when they run out, they're coming back and asking for it again, because for them it was either a lot less expensive or a lot easier to use. And again, sometimes the pressure goes down, and of course that's always the main goal for treating glaucoma, is to lower the eye pressure.